Hey, everybody. Good evening from Dr. Kadisha, Dr. Carol, and Dr. Dietrich here on Perspectives in Primary Care. And on this episode, in observance of Pediatric Obesity Awareness Month, we are going to discuss its causes, complications, treatment, and prevention tonight. Because you know why? Because obesity is a worldwide problem. We always talk about how pediatric obesity is a major problem in America, but it's actually a worldwide condition. So we're going to get started with Dr. Dietrich, and then I'll chime in, and then we'll end with Dr. Carol. So, Dr. Dietrich, why don't you start us off?
Hey, okay. Thank you very much, Dr. Kadisha. And hello, Dr. Carol. It's so nice to see y'all again on another episode. And I'm so glad that we're here to be able to share this knowledge in honor of Pediatric Obesity Month. And so I'm going to get started. Like Dr. Kadisha was saying, I'm going to be talking about the definition of obesity in childhood, as well as the statistics and some risk factors. And so the definition of childhood obesity is actually used by the measurement of the body mass index. You all may have heard of that. It is used to determine the childhood overweight and obesity. And overweight is actually being defined as a BMI, body mass index, over the 85th percentile and below the 95th percentile. So y'all parents out there who have taken y'all's kids to like the well child check, the doctor may give you like a handout with the growth curve, like with the height and the weight and whatnot. They might have the pounds on there or the kilograms, but then there's also one for the BMI. So then obesity is actually defined as 90 over the 95th percentile. So that very last line on that growth curve is the 95th percentile, and so over that is considered that obese range. And so for all of y'all who are just earning and just really want to know, how do you calculate the BMI? All right. So it's actually divided by a person's weight in kilograms over the square height in meters. So, using this metric system and stuff is not in the pounds and inches and stuff like that that we may be used to in America, but the kilograms in the height. And then for the children and teens, the BMI is actually age and sex specific and is often referred to as the BMI for age. And a child's weight, their status is actually based on using the age and sex specific percentile for the BMI rather than exactly the way it's done for adults. Okay, because children's body composition and stuff like that varies as they get older. So you can have like a 2-year-old versus a 17-year-old. They're still considered children, but you won't really necessarily hold them to the same criteria because the body composition is different. More fat here, more muscle there, that kind of thing. All right. And the CDC growth charts are actually most commonly used to measure the size and growth patterns of children and teens in the US. But y'all need to keep in mind that the BMI doesn't measure body fat directly. All right. But it's shown, it's like an indirect measurement and an alternative to the direct measurement of body fat. So please keep that in mind, because you can have a really a big person, like an adult or even a child, that has more lean, but they're still considered overweight, but they're not really. So just please keep that in mind as well, okay? So I just want to go over a couple of stats, and please, whoever's coming in, please feel free to say hi to us. We love to know that we have y'all support out there and know that y'all watching, so we can keep things moving. All right, so please do that whenever you chime in. So a couple of stats on childhood obesity. Um, Pediatric childhood and obesity is actually the most prevalent nutritional disorder. So yes, it is nutritional disorder in children and adolescents worldwide. There's approximately 43 million individuals that are obese, and 21 to 24% are children and adolescents are overweight. 16 to 18% of the individuals have abdominal obesity. The prevalence of obesity is highest among specific ethnic groups, and I'll talk about that in just a second. And the National Health and Nutritional Examination Survey, that's where we got this information, reported that the prevalence of obesity is on the increase in all pediatric age groups. I know Dr. Carol, one of her champion causes is helping to eliminate obesity, or especially have more awareness to eliminate obesity in her lifetime, because it's one of the big pandemics that she talks about. Um, Over like 90% of obesity causes are actually non-genetic and hormonal, and less than 10% are associated with genetic and hormonal causes. So, some people like to say, oh, being overweight runs in the family, and I understand that, but I'm going to actually talk about risk factors. And so you have to kind of think about it in the way I'm going to be presenting it, that, birds of a feather. So people who live together may eat the same things, and they might say, oh, it runs in the family, when really, it's some of the choices that we're making and what we're actually feeding ourselves. So a couple of stats that are specific in the US, the prevalence of obesity was 18.5% and affected about 13.7 million children and adolescents. So that's a whole lot of folks. Obesity prevalence was 13.9% among 2 to 5 year olds, 18.4% among 6 to 11 year olds, and 20.6% in 12 to 19 year olds. So it's definitely out there. As far as like ethnic groups, Hispanics and non-Hispanic Blacks make up the majority. They're higher obesity prevalence, 25.8 in Hispanics and 22.0 in non-Hispanics or Black folks. And non-Hispanic Asian people had the lowest obesity prevalence. So let's talk about some of the risk factors. There's a few risk factors that I want to discuss, and one of them are the parents who are also overweight. So bigger folks, obese parents and overweight parents have children that are that way. So children with parents who are also overweight, they may have an increased risk of becoming obese, possibly due to genetics, or possibly, and more so, unhealthy learned behaviors. All right. So parents that don't eat healthy foods or get enough physical activity, maybe encouraging their children, not necessarily intentionally, but to be repeating their patterns, okay? Because y'all all live together, y'all all doing the same things. So this is directly or indirectly. And of course, most parents want their children's best interests at heart. And they want them to be happy, and some of them may interpret that as, stop hollering, stop crying. I'll give you what you want. Here, eat this. You know what I mean? So, stop crying. So eat this. You know what I mean? And that'll stop them from crying. And so I like to tell my parents, especially in the well child visits, that you are the parent. You're the one who are establishing your eating habits when they are becoming older. Okay. And you're at a point now where you can control it, but when they get out there and become teenagers, they be eating what they want to eat, what their friends and stuff are eating, and that's where the mess starts happening. Okay. Having said that, body weight may be influenced by genes, and children with certain inherited genes may gain weight more easily, and there's some predispositions to some medical issues that can be leading to obesity and overweight. And while these weight issues may run in some families, not every child with a history of obesity in the family ends up being overweight or obese. So please keep that in mind as well. So it's totally like a combination genetics versus the environment as well, but also, what you're actually consuming. So another reason is actually a poor diet. And in many cases, kids who are obese may be eating too much and not getting enough exercise. And actually, when these kids get their calories from unhealthy processed foods, and then they don't, get out there and burn those calories off, those are converted to fat. All right. And these unhealthy food choices may actually lead to larger portions in their foods, drinking a lot of sugary drinks, sodas, processed foods, and that kind of thing, high fat foods. And another big one, because they're so convenient, is eating out at these fast food restaurants. You got these, 3 sandwiches for $5. I mean, that's a great deal. You know what I mean? Especially if you don't have that kind of money, but it's really not the best. It's just not the best as far as nutritional value. And like I was saying, poor diet habits can run in families. All right. And the best way for parents to help change their family's eating habits is to make healthy foods like fruits and vegetables and cook. And, maybe y'all all can get together and cook your meals together and make it fun. Okay. And going back to the family meal time, maybe sitting at the table, having these servings of foods and that kind of thing. But I know we're going to talk more about that, a little bit later. Another reason is the actual lack of physical exercise. So all I have to say is social media, video games, cell phones, laptops, TV. All right. They all have in common. You could just sit there. Okay. It's entertainment, but you're just sitting there. You're not moving. You're not doing none of that stuff. Unless by some chance one of your TV shows are like one of those exercise TV shows. But most of the time watching a comedy or some type of movie or whatnot that doesn't really entail moving around. All right. And the more that a child becomes less physically active, the higher the risk they will become overweight and obese. All right. So one of the things, of course, like Dr. Kell's going to be saying is schedule some family time, some activities and that kind of thing to get things moving. Another reason is good old fashioned boredom. You know, kids' minds are, wondering they want to be doing things, but sometimes they just get bored. And so one of the things they do to fill their time is go eat something. Let me go get a snack while I'm watching TV. So boredom is something that can contribute to that. Another big one that, I talk about too is actually stress. Being a child, whatever age, can be stressful the way they're perceiving their own stress and their own problems. So kids that are going to school, they have their homework, they have the pressures of getting good grades. They have those pressures of trying to fit in. You know what I mean? And if you're already heavier, you might have, bullying, or you might have a stigma or something like that, which can actually be very, very stressful. And just being a teenager alone is already stressful. You got those hormones and stuff going, and you're trying to fit in. It's just like a big mess. So one of the things you do, you might quote self-medicate and eat it, eat that stress, and go towards poor coping mechanisms that you eventually lead into adult. So learning those poor coping mechanisms, via food or poor nutritional choices, definitely affects a child, and then they carry that on into adulthood. In addition to school stressors, you have those home stressors. We don't know what kind of environment it is at home. Ideally, you want to be in a loving home, supportive, parents getting together, money's not an issue. You get to go different places, but that's definitely not the case for a lot of kids that are growing up out there. There could be some abuse, uh, siblings might not be getting along, the parents might not be getting along, and even if it's not verbally communicated, you feel that extra tension in the house if it's not a harmonious home, and that's definitely stressful. And again, there's poor coping mechanisms to dealing with that stress. Okay, and children and teenagers may not have a good way to channel that stressful energy. Okay, it might not be learned, and so there's another risk factor as well. Another really, really big one is limited access and resources. So, this is gearing more towards the parents. If parents don't know, you know, what's good to eat, then they can't pass that on to the children. And it's important for the parents to become educated as far as what's healthy eating, what's beneficial exercise, what is positive mindset and everything, so they can pass it to their children. And if they have like a heavy child, they don't want to be shaming their child, or you too big, you don't want to be such and such. You want to support them so that they'll be able to, have those healthy habits when they're eating and growing up and forming their adult habits. Okay, and then the affordability. Poor families unfortunately don't have all the options to get healthy foods, because eating very healthy can be very expensive, and so that's definitely a big risk factor. Again, leading to those fast food choices, poor nutrition, high calories that are nutritious. And then finally, marketing. That's a big one. I don't know if any people think about that, but marketing. When you see these TV commercials and whatnot, we're advertising these cute commercials with animals eating cereal and eating, hot dogs and, pizza and cheese and all that stuff, and it looks fun. I want to try that. So marketing is a big one. You know, you don't see a carrot dancing around. You know, you don't see the head of lettuce dancing around, you know, saying eat me. You know, you see the bag of chips saying eat me. And so marketing is soaks into that subconscious, and you're like, oh, when we at the store, let's grab that. You know, you rarely see a kid go, you know, for some apples, you know what I mean, in the store. The parents got to teach them to go to the apples. All right. So those are some of the risk factors for childhood obesity. And as you can tell, there's really no concrete 100% reason. It's definitely multifactorial. But knowing that this is an issue, the main thing is to become educated as a parent and then teach your children so that they can, you know, make good choices when they become older. So I don't know if there's any questions out there. I can't see the chat, so I don't know if anybody's chiming in or not, but we'll keep going. And I know Dr. Kadisha is on the ready to talk about some of the complications because definitely, as we've talked about many times on this show, food is medicine. Food can be our toxin as well. It can be our healer, and it actually predisposes you to having all kinds of complications what you're feeding your body. So Dr. Kadisha is going to be talking about the complications and consequences of childhood obesity. All right, you okay?
Thank you so much.
Welcome. You're welcome.
Yeah. Okay, so yeah, just looking at the comments, let's see. So Kiva said that she found that she mentioned the you know, the balance between healthy food versus the good tasting food that her kids like to eat, and she was saying that she's found good healthy food that tastes good. She says her kids aren't overweight, but they still love to eat. So she's found that balance despite the videos, the computers, and the COVID. She's managed to find that balance. So so if you could put some tips in the chat there for the rest of us on how to make healthy food taste good, especially for kids, I think a lot of people will, no pun intended, gobble that up. So
I'm sorry.
So
I love those play on words.
I'm always playing with words and alliterations, and so yeah, I referred to the pandemic pounds. We are dealing with the pandemic pounds, pediatric obesity. You know, we all could use some tips on, especially as we go into the holidays. You know, that's when we typically put on more weight. So now we're carrying, you know, spring, summer weight into the holiday season. So we really need to get things under control. So because we have to worry about the consequences of obesity, and there are immediate health risks and long-term healthcare risks that we have to worry about. So obesity during childhood can harm the body in a number of ways. Children with obesity are more likely to have high blood pressure, high cholesterol, which are risk factors for cardiovascular disease. That's the top killer of, you know, in the United States, if not one of them. In addition to that, there's the increased risk for impaired glucose tolerance, insulin resistance, and type 2 diabetes. It is amazing to meet in the ER people in their 20s, their early to mid 20s, who aren't type 1 diabetics. They're not juvenile diabetics. They are type 2 diabetics. They already have the condition that we typically don't worry about until our late 30s, 40s, 50s. Also, a particular concern are breathing problems such as asthma, sleep apnea. You know, when you imagine sleep apnea as a physician, you think of, you know, an older person, someone who smokes, things like that. But there are young children, because of their obesity, who have sleep apnea. And according to the American Journal of Epidemiology, was an article published in 2013. They stated that among youth who developed asthma, those who were moderately or extremely obese had more frequent asthma flares, requiring emergency department services and or oral steroids. And then the steroids, if you have to keep using steroids over a long term, that puts weight on you. It's like a vicious cycle. Studies have shown that obese patients with asthma are often prescribed a greater amount of the beta agonists, which are the inhalers, and oral steroids, and have more frequent emergency department visits and hospitalizations for these asthma flares than their normal weight counterparts. There are other things like joint problems and musculoskeletal discomfort. Carrying extra weight that your frame is not meant to handle can literally be painful. And you have young people who have arthritis. I remember being in medical school with a beautiful young lady in my class who was morbidly obese, but she had to walk around with a cane because her arthritis was so bad, and she was in her 20s, and she eventually dropped out of my class because she had so many difficulties with it. And then there's the fatty liver disease, which is, that requires a discussion in itself, because a number of patients I have come in with abdominal pain and they can't explain it. The lab work shows mildly elevated liver enzymes. They say they have so much pain. We get a CAT scan and all we find is fatty infiltration of the liver, which means that there are globules of fat that are spread throughout the person's liver because of their diet. And that diet also puts young folks at risk for gallstones, which is typically not something you experience until like your 30s or 40s. They used to say, fat, fertile, and 40. That was how we remembered someone who's more likely to have gallstones. Keyword 40, not 14 or 24. And then the obesity also puts you at risk for reflux disease like heartburn. And, that's a persistent, painful condition to have. So in addition to the physical, or the somatic issues of pediatric obesity, then you have to add on top of that, the psychological issues. Especially nowadays, it seems like the fat shaming is at an all-time high. And, so we already have enough anxiety with the COVID-19 pandemic. I mean, that's like an everyday thing in the ER, but then imagine adding to it anxiety and depression over being chronically overweight, being obese in a society that, that praises people who are slender just because they are slender, who treat people who are slender better just because they are slender. That leads to low self-esteem, lower self-reported quality of life. And they might also have to deal with bullying and the stigma of the obesity itself. And then the most serious thing, the most concerning issue with pediatric obesity is the fact that these children become adults with obesity. It is great to see a person who is not obese as an adult who was obese as a child, but more likely, if you are obese as a child, you're going to carry that into adulthood. And and we already know what risks, we face as adults, being slightly overweight, but then adding obesity to that, there's increased risk of several serious health conditions like heart disease, again, the type 2 diabetes, and even cancer. If children have obesity and those disease risk factors in adulthood, all of those conditions are more likely to be severe. Now, I did some research to see, though, how does this show up in the ER? And, what kind of complaints are more frequent in overweight or obese children? And almost as expected, cardiovascular complaints were more frequent in obese children than their normal weight counterparts. And endocrine issues were also more of an issue as well. The greater the weight, moderately obese, severely obese, those were more frequent complaints or reasons or diagnoses once they were seen in the ER. So now that we've talked about the consequences and complications again being more frequent hospitalizations due to asthma, that seemed to be the main thing. Asthma was the biggest concern. Hospitalizations, more medication, the vicious cycle of steroids, which can put on weight, which again may make asthma more severe. Now that we've gone over that, we want to go on and talk about treatment and prevention. We want to take this, in the more positive direction with the mindset master, the meditation master, and the obesity medicine expert, Dr. Carol.
You very much have to
Wait, unmute. Okay.
Okay, I'm unmuted. Thank you very much, Dr. Khadijah and Dr. Dietrich. So in my practice, I do treat mostly adults, far more adults than I do children. So I've just taken lots of notes to share with you tonight. And there's some really excellent information. We do have a question here: how much physical activity should an 11-year-old and a 14-year-old get on a daily basis? And I'm going to answer that question as we talk about prevention of pediatric obesity. And hopefully I'll be able to get all the way to what we call the tertiary treatment or indications for bariatric surgery in childhood or adolescent populations. But we're gonna go as far as we go, and we're gonna make it do what it do. So the primary focus in treatment in obesity for the pediatric population, believe it or not, is prevention. And what is so amazing to me about this is what it should be in the adult population as well. So the idea is that we want to cultivate permanent, healthy lifestyle habits. And that needs to start from littlest ages on up. Children are able to learn and adapt and understand some of these concepts as young as 2 years of age. And it does begin with the parents, because of course the parents with children are the ones going out doing the food shopping, the food preparation, serving the food, offering the food. But that's the primary goal in childhood obesity, to look, how do we optimize long-term health outcomes with a focus on cultivating healthy lifestyle. Now, here's something I want you all to write down. 5, so very easy to remember, 5, 2, 1, 0. 0. This is the algorithm for treating childhood obesity across all the ages, from 2 years old on up. So you want to do 5 or more fruits and vegetables daily. And I'm going to talk about doing something like a green shake or a smoothie to get, because that's hard to get in, even in COVID-19, when we've been shut in the house a lot. People are talking about it should be called the COVID-19 pounds, because children and adults have been packing on the weight. This is an opportunity to really learn about healthy eating and healthy cooking. You're in the house, so let's get healthy together. I know people who have gone both ways, people who have fallen off the wagon and gained the weight and whatnot, and other people who chose this as an opportunity. Well, let's plant the garden. Let's find out about how we can improve our diets. So either way, you get to choose. You get to choose. And why not choose to do the things that take a little time to learn about. Particularly, we aren't, sports have been canceled, or a lot of parents to protect their children have taken their kids out of sports activities. There's sitting in front of the Zoom all day. Well, when you get up, you need to get up and you need to incorporate some moving. Mom and dad working at home, kids working from home. You can all, you can take movement breaks together where you get up and you put on some music and you just dance. But anyway, I digress. Let's get back to 5, 2, 1, 0. So 5 fruits and vegetables daily. And I do recommend that you start the day with some sort of green smoothie. And I'll throw out some ingredients for that at some point this evening. 2 hours or less of recreational screen time. Now, unfortunately, the Zoom classroom evolves right into the video game, evolves into the Netflix movie, evolves into the TV show. You really, as parents, I'm really asking my parents to stay on top of this. Stay on top of this. Get the kids away out of that virtual classroom situation. You've got to put the activity in. You've got to get them outside some kind of way. You've got to do this. Here's the answer. It's 1 hour or more of physical activity daily. That's what you want for the pediatric population across all the age groups in the pediatric population from 2 up. 1 hour or more of physical activity daily. So if they aren't in organized sports anymore, you have to get out. You have to, go take that walk. Take the walk together as a family. Do a little, jog together as a family. And 1 hour, it's critical for kids to get 1 hour or more. And here's the big one. 0 sugary drinks. 0. That means no soda, none, 0. That means no fruit juice with the high fructose corn syrup in it, 0, none. You want your kids to drink water. And it says, one of the, recommendations coming out of Harvard is low-fat milk. I am not a proponent or advocate of dairy products at all. So, I would say, your water, almond milk could be okay. Rice milk could be okay. I prefer the almond over rice, and coconut milk can certainly be okay. So I recommend either almond milk or coconut milk. I'm not even that big a proponent of rice milk, and I certainly don't recommend dairy or cow's milk. So that's it. You want to remember 5, 2, 1, 0, and you want to stay away from processed foods. If it doesn't rot, you probably shouldn't eat it. Period. End of story. If it doesn't rot, you shouldn't eat it. And I do recommend that parents be label readers and also teach your kids how to read those labels. And so that, that 5, 2, 1, 0, that's very simple, but that's the algorithm that's recommended by Obesity Medicine Association, Harvard, for treating and preventing childhood obesity. So now there are 4 stages of treatment. There's stage 1, which is the prevention plus. That's the 5, 2, 1, 0. There's stage 2, which is structured weight management. And most pediatricians can help you with this, but you might want to see someone who is an obesity medicine specialist who has an interest in children once you start to get into stage 2, but definitely for stage 3, which is comprehensive multidisciplinary intervention. So then you're working with a nutritionist. You might be working with someone with exercise and movement. You're working with your medical doctor, all right? And then stage 4, tertiary care intervention. And that's when you get into your adolescent or pediatric surgeries. So let's go over those stages right now. I think I've got a few more minutes. Someone's saying they had coconut milk ice cream the other day and it was so good. It had cashews in it, non-dairy. Bing, bing, bing. It's delicious. It's delicious. It is delicious. So here we go. And I grew up because it was discovered when I was a baby, actually, that I had a sensitivity to cow's milk. Because you say, oh, human babies need milk. And I know they don't. Human babies need human milk. And after they reach a certain stage of development of around 18 months, they don't need that. Because they're eating a varied diet at that point. They should be getting their nutrients from food. But, as long as, the mother-baby pair are nursing, however long that relationship goes on, human milk is ideally designed for baby humans and to develop a baby human. So, I haven't had a glass. If I can honestly say I haven't had a glass of milk in 62 years, 63 years, because I didn't grow up drinking milk at all. And most people become lactose intolerant at some point, and they run into GI distress, weight problems, weight gain, weight loss problems, and they don't realize it's because of the dairy products that they are ingesting. So that's no cheeses, that's no yogurts, none. You can maybe tolerate like a goat yogurt, or a sheep yogurt that's a little bit more digestible in the human digestive tract than cow's milk yogurt is. But here we go. Prevention Plus 5210. You want to have a daily breakfast. You want to limit eating out, which is great during this COVID-19. Home cooked meals are much better for us. We want to have family meals. Dr. Dietrich, you mentioned that, the importance of the family meal, because it's also that mind, body, and spirit, sitting down, expressing gratitude together. You want to practice limit portion sizes. Allow the child to self-regulate their meals. Don't force feed or overly restrict. Every time the child has something emotional going on, don't just, reward with food or punish with food. Just don't do that. You want to increase the physical activity, and you want the physical activity for younger children to be unstructured. So good old-fashioned play. And then finally, you want the activity for older children. Older children do better with structured activities. And I know that's a little bit hard. If, you're not a phys ed teacher. One of my friends is saying, she said, I'm an orthopedic surgeon, but this is just not my calling to be a school teacher with these boys. Not my calling. So, but you do need that structured activity for older children. And there are a lot of things out there on YouTube and Netflix that are actually good structured activities for the older kids. You want, this would be more for the providers out there that are working. So I'm going to skip this. So structured weight management is stage 2 in prevention. So this is planned diet or diet eating plans that you want to put the child on. And diet is not an end game. With any other species, we say, oh, well, that's the elephant's natural diet. That's the chimpanzee's natural diet. It is your eating behaviors that support your life. And so that's really the definition of diet, not something that you go on to lose 15 pounds. And then when you lose the 15 pounds, you go back to the eating behaviors that triggered the weight gain in the first place. No, diet is your lifestyle behaviors. You want to really work with a nutritionist, somebody who's knowledgeable, and this is the way you're going to eat for your life. This is how this is the lifestyle eating behaviors for a healthy child. This is the lifestyle eating behaviors for a healthy adult. This is the lifestyle eating behaviors for, a healthy family. Again, reducing that TV and screen time to less than an hour per day. Less than, what's on? What's on there? You've been on Zoom all day working and in the classroom, what you gonna watch TV for and sit some more? That doesn't make any sense. All right, so plan supervised activity for 60 minutes a day. This is in stage 2. You want to definitely plan it in stage 2. And food recording or logs of food and beverages. Food recordings or logs of food and this is very helpful. I tell people to do this 2 weekdays, like on a Tuesday and Thursday, and then do one on a Saturday or a Sunday. A lot of people don't even realize what they're eating or how differently they tend to eat on a weekend than they do during a weekday. Thank you, Dr. Khadija is putting all these nuggets in the chat. So that's your stage 2, structured weight management in the adolescent population. All right, so this is very important. And when you're working with your medical professional, you want to have frequent visits. And if the medical professional isn't offering that, please reach out, go to the Obesity Medicine Association and get some recommendations for obesity medicine specialists. Reach out to me for sure. And hopefully I'd be able to, introduce you to somebody in your community or be able to evaluate and help you. Stage 3, so this is comprehensive and multidisciplinary. So let me just go back here to look my notes. So this is your stage 2 structure plus increased intensity of the structured physical activities, the food logs, less than, so you really want to, drill down on these things. You're going to, again, increase the frequency of visits to your healthcare team, and you're going to look for a specialist. You're going to look for it. So here in a structured program, we're looking for behavior modification, food monitoring, short-term diet, physical activity, and goal setting, as well as parental training to improve home environment. All right, so here's stage 4. I'm going to, wrap this up really quickly. So stage 4 targets adolescents with severe obesity after at least 6 months of stage 3 intervention. So you want to try the intense structured program first for at least 6 months before they could qualify for the tertiary, which is the surgical. Mature children capable of understanding risk. So typically it's not younger than the age of 13. They need to understand the risk and benefits of a surgical intervention. And there should be a pediatric weight management center with a comprehensive multidisciplinary team, or else, you put the child through the intensity of the surgery, but only to have them regain all the weight, because this has to continue from that. It's the support afterwards. It's the follow through afterwards that allows a successful surgery to be complete. And that's to be for the patient to be satisfied, for them to have cultivated with their team a lifestyle that they can follow so they can keep the weight off that they've now dealt with surgically. So other part of stage 4 is very low calorie diets. So protein sparing modified fast refers to a caloric intake of 300 to 800 kilocalories a day. So you can see this has to be monitored medically. Need to monitor the electrolytes, and that's, one approach. Medications, metformin is approved for children older than the age of 10. You have to check them for PCOS, polycystic ovarian syndrome, and also for insulin resistance. And then there's another medication, orlistat, who's approved for children greater than 12 years of age. And then the weight loss surgery. So those are some of the avenues we have for the tertiary care or stage 4 prevention. So I'm going to, wrap it up there. So quick recipe for a green drink. You want to put 3 to 4 apples in there. You want to put a handful of kale, spinach, 1 cucumber, and 2 or 3 stalks of celery. Blend it all up. The apples will give it some sweetness. And of course, you get the natural sugar from the apples. You don't put any added sugar in it. And, there you've got your cucumber, your celery, your kale, your spinach, and your apples. It's hard to get 5 servings of fruits and vegetables in a day, but you can start your day off with that. And, blend it all up and drink it down. And it's really interesting because you will notice a boost or a lift in your energy. So that's all I got time for, you all.
I just wanted to add to when you were talking about earlier about no soda, no sugary drinks, none of that stuff, juice, all that stuff. One of the things I wanted to add, sometimes you like a little bit of flavor with your drink. And so what I recommend and what I typically do is like fresh squeezed lemon. Some lemon in the water is quite refreshing. It's very hydrating. It gives that little extra flavor. Of course, not with any sugar or sweetener, none of that stuff, but just fresh squeezed lemon water is excellent. So that's one of the recommendations I have if, you don't really want to do the juice or the soda, but it's nutritional and it's delicious.
Another tip, try that, putting some cucumber and letting that soak in your water. That is delicious and refreshing. If you have to do a carbonated beverage, make sure it's non-caloric. There are flavored seltzers out there, less healthy because the body doesn't like all that gas because, that is gas that makes the carbonation, but it is certainly way better than having a soda. You might as well just be pouring sugar into your veins. And that is never healthy in circumstances. Yeah. So you can do it. You can do it tasty and flavorful. You can make your beverages tasty, flavorful, healthy, and it's up to you. And this is a perfect opportunity in this pandemic caused by COVID-19 to learn a little bit more about food as medicine and implement it together as a family. Just try it little bit by little bit. And see what happens. And instead of saying, oh, I gained the COVID-19 pounds, this is an opportunity to lose the COVID-19 pounds. This is an opportunity to try out the different exercise programs and routines that are popping up all over the place. I work out virtually with my personal trainer. I take an online dance class. My goodness, I broke my foot working out during the shutdown, so I don't go that far, but you could do, I've been doing online Qigong classes. I do workout Wednesday and we do Qigong moves. So if you've got some physical limitations, that's gentle movement that just about everyone can do. Sitting down, lying down, standing, the options are there. Let this be a golden opportunity to do something about the worldwide pandemic. That's one of the 5 pandemics I talk about, the worldwide pandemic of obesity. And certainly, my goodness, for our children, so they don't have to grow up with all the comorbidities. Overweight and obesity itself is a risk factor for the comorbidities of COVID-19. So you really want to do what you can to prevent it and develop the lifestyle habits that you need to develop.
And I wanted to just chime off what you were saying too, as far as the family, make it a family thing because you all are all living together. You're all watching TV together. So why not all walk together? Why not all go dance together? Cook together, do that. So instead of just shifting the energy to sitting on the couch and watching TV, get out there and get some fresh air, so you can have a dance contest with the family, make it fun and enjoyable and laugh and all that stuff. So just try and make it a family affair to have more of a healthful eating and exercise regime because it's affecting the whole family.
Yes. And one last question from Victoria, our super commenter here. She asked if honey is a good substitute if you need sugar? Is
Well,
honey a good
you can
substitute?
get away with a little bit of honey. Now, if you really want to be a purist about it, you want to at some point you eliminated all sweeteners, even natural ones. You can take your and just re-educate your taste buds. And it's funny when you start to add things back in. It's like, wow, it's so sweet. But yeah, you can. Generally speaking, add a little bit of honey to sweeten things, and particularly if it's honey from your area, that's really good to help with allergies. However, if you're a vegan, that's one of the things you don't eat at all ever is honey. So it really
Right.
depends. But yes, if you are a person that does consume a range of sweeteners, then you have to eliminate all the other ones. You can hold on to a little bit of honey.
Okay, thanks so much, Dr. Carol. And there's 10 people in here. We want to thank everyone who is here, especially those who stayed throughout the discussion and who contributed their advice, experiences, and tips and all, and questions. We thank you so much. And if we're on 51 minutes here, so we'll close out, but do continue to like, share, comment, let us know of other topics that you'd like us to discuss in the future, that you would like to discuss with us in the future. And thank you so much. Thanks so much, Kiba, for coming in. And yeah, do join us again in the future. Everyone join us in the future. And you guys have a great night, and see you guys next time. Thank you so much for coming. Oh, but yeah, I'm sorry, but yeah, our farewells, forgot the farewells. So yeah, I'm Dr. Kadisha. I'm your board certified emergency medicine physician, author of the book, Help Us Help You in the Emergency Room. Dr. Carol.
Hey, I'm Dr. Carol Penn, doubly board certified in family medicine and obesity medicine, and your master movement meditation and mindset coach, and author of Meditation in a Time of Madness, a guidebook for talented teens, tweens, their parents, and guardians who need to thrive.
And I am Dr. Dietrich Gorman. I'm also known as America's Relaxation Doctor. I'm a best-selling author and speaker. And again, thank you all very much for joining us on this wonderful Monday. And we will see y'all on another episode of Perspectives in Primary Care. Bye, y'all.